Hello students, in this video we are going to study pharmacology of serotonin, also known as 5-hydroxytryptamine. In short, it is 5-HT. Now we will discuss synthesis of 5-HT, sites where it's primarily synthesized, then functions of serotonin, serotonergic receptors and pharmacological actions of serotonin in this video. Now this video is fourth in the series of videos on Autacoids. Now one of the most important functions of serotonin is to regulate mood. When the levels of serotonin are normal, one feels highly focused, emotionally stable and happy. Thus, very important to remember that serotonin or 5-HT is a substance of well-being and happiness. Now, low levels of serotonin are associated with depression. Serotonin is a monoamine neurotransmitter and therefore it transmits information between the nerve cells in the central nervous system and throughout the body. Serotonin is an autacoid. As we know, autacoids are local hormones. So, serotonin is a local hormone. It's primarily synthesized in the central nervous system and in the gastrointestinal system. And it is preferentially used also in these areas. Now, the sites where serotonin is found in the body, around 90% of serotonin in the body is found in the gastrointestinal tract, and the rest 10% is found in the platelets and in the central nervous system. Now, synthesis of 5-hydroxytryptamine. 5-hydroxytryptamine is synthesized from the amino acid tryptophan. Tryptophan is derived from the diet. Now, many food articles naturally contain tryptophan like cheese, tofu, pineapple, nuts, tomatoes, etc. So, 5-hydroxytryptamine, that is 5-HT or serotonin, is derived from the amino acid tryptophan. Now, 5-hydroxytryptamine is degraded or it is metabolized primarily by monoamine oxidase. So, monoamine oxidase enzyme metabolizes 5-hydroxytryptamine to 5-hydroxyindole acetic acid. Now, small amount of 5-hydroxytryptamine is also metabolized by the enzyme dehydrogenase. Look at this figure. This figure explains the utilization of 5-HT released at the synapse. Now, let's see how this 5-HT is utilized by the neurons. Now, this is the presynaptic neuron. This is a presynaptic serotonergic neuron, while this is the postsynaptic serotonergic neuron. In between these two neurons is the synapse, where serotonin is released. Now, serotonin is found stored in the presynaptic vesicles. Now, when this presynaptic neuron is stimulated, serotonin is released in the synapse. Now, serotonin has wide variety of serotonin receptors. There are 7 families of serotonin receptors consisting of around 14 types of serotonergic receptors. Now, this figure shows presynaptic serotonergic receptors as well as postsynaptic serotonergic receptors. Now, these receptors are located on the presynaptic serotonergic neuron. Now, these receptors are the 5-hydroxytryptamine 1 receptors, and these receptors are termed as autoreceptors. Now, binding of 5-hydroxytryptamine to these autoreceptors produces inhibitory effect. It reduces the firing of serotonergic neurons, preventing serotonergic neurons from releasing too much 5-hydroxytryptamine at the synapse. Now, these are postsynaptic serotonergic receptors. Now, serotonin that is released or 5-HT that is released at the synapse binds to presynaptic as well as postsynaptic 5-HT receptors to produce the pharmacological action in the body. Now, serotonin that is not utilized by these receptors is transported back to the presynaptic neuron from the synapse. Now, serotonin transporter, that is SERT, transports serotonin from the synapse to the presynaptic neuron. Now, within the presynaptic neuron, a part of serotonin is metabolized by the enzyme monoamine oxidase to 5-hydroxyindole acetic acid, while the remaining serotonin is transported to the serotonergic vesicles by vesicular monoamine transporter, that is VMAT2. So this is how serotonin that is released at the synapse is utilized. Now, as we know that 5-hydroxytryptamine is synthesized from the amino acid tryptophan. Now, 5-HT is synthesized in the raphe nuclei in the brain stem. Majority of 5-HT, around 90%, is synthesized in the gut, and it is stored in enterochromaffin-like cells in the gastrointestinal mucosa. Now, platelets do not synthesize 5-HT. Platelets only store 5-HT, and platelets get 5-HT from the intestinal blood vessels as serotonin is synthesized in the gut. Now, let's study about the primary role of serotonin in the body. Now, serotonin plays many important physiological roles in the body. Now, first is the neurotransmitter. As already discussed, serotonin is a neurotransmitter, and as a neurotransmitter, serotonin transmits information or the messages between nerve cells in the central nervous system and throughout our peripheral nervous system, thus regulating functioning of the body. Again, very important, serotonin regulates the mood, and it is known as a substance of well-being and happiness. Low levels of serotonin produces depression. Now, many medications which are used to treat depression and other mood disorders often try to increase the levels of 5-HT in the brain. Serotonin plays several important roles in the body, and it is involved in the regulation of temperature, thoughts, then cognitive functions, behavior, mood. It also regulates appetite, vomiting, and perception of pain. Serotonin is a precursor of melatonin. That is, serotonin is required for the synthesis of melatonin. And melatonin is a hormone that regulates the sleep-wake cycle of the body. Serotonin can trigger nausea and vomiting. Now, this action of serotonin is mediated by its 5-HT3 receptors, and this we will study in detail in our next video on serotonin agonist and antagonist. Serotonin in the gut regulates peristalsis and bowel function mediated by serotonin 5-HT4 receptors. Now, serotonin that is stored in the platelets regulate wound healing. Now, serotonin helps in the formation of clot, and further it helps in the healing of the tissues at the site of injury. Now, let's study classification of serotonergic receptors. Serotonergic receptors are found in the central nervous system as well as in the peripheral nervous system. Now, they mediate excitatory as well as inhibitory functions. Now, these serotonergic receptors are activated by serotonin, which works like a natural agonist. Now, 5-HT receptors are divided into 7 families. Now, each family consists of one or more than one receptor subtypes. There are total 14 5-HT receptors. Now, there are 7 families, namely 5-HT1, 5-HT2, 5-HT3, 5-HT4, 5-HT5, 5-HT6 and 5-HT7. Now, 5-HT1 family consists of 5 receptor subtypes, namely 5-HT1A receptor, 5-HT1B, 5-HT1D, 5-HT1E and 5-HT1F. Similarly, 5-HT2 5-HT2 family has three receptor subtypes, namely 5-HT2A, 5-HT2B and 5-HT2C. 5-HT3 family has only one receptor, that is 5-HT3 receptor. Similarly, 5-HT4 family has only one receptor, that is 5-HT4 receptor. Now 5-HT5 family has two receptor subtypes, namely 5-HT5A and 5-HT5B. 5-HT6 and 5-HT7 families have one receptors each. All these receptors are G protein coupled receptors except the 5-HT3 family. Now 5-HT3 receptor is a ligand gated ion channel that encloses sodium and potassium channels. Now binding of 5-HT or serotonin to these receptors open sodium and potassium channel, and change in the ionic concentration causes depolarization of nerve endings, and thus these receptors produce excitatory responses. Now as shown in this table, all 5-HT receptors are G protein coupled receptors, and stimulation of these G protein coupled receptors produce secondary messengers like cyclic AMP, then inositol triphosphate, which mediate either inhibitory or excitatory responses. Now 5-HT1 receptor produces inhibitory responses as they activate G inhibitory protein. Now activation of these receptors decreases intracellular concentration of cyclic AMP, that is adenosine monophosphate, and produces inhibitory response. Now 5-HT1 receptors are autoreceptors, as we have already discussed. Now these produce inhibitory responses and prevent serotonergic neurons from releasing too much serotonin at the synapse. Now 5-HT2 receptors are GQ protein coupled receptors, that is stimulatory G protein, and activation of these receptors increase intracellular concentration of inositol triphosphate and diacylglycerol, and this produces excitatory responses. 5-HT4 receptors are also excitatory receptors. Now functional roles of 5-HT5, 5-HT6 and 5-HT7 families of serotonin receptors are not very well known. However, these receptor families are closely related to 5-HT4 receptor family. Now after discussing the classification of serotonergic receptors, let's discuss pharmacological actions of serotonin, also known as 5-hydroxytryptamine. Now as we all know, serotonin acts as a neurotransmitter in the central nervous system as well as in the peripheral nervous system. So apart from being a neurotransmitter, it also mediates non-neuronal actions in the tissues like gastrointestinal tract and on the blood vessels. So we are going to discuss here neuronal as well as non-neuronal pharmacological actions of serotonin. Now serotonin exerts direct as well as indirect effects on the body tissues and organs. Now indirect effects are mediated by the release of some other substance by 5-HT. Now first let's see the effect of serotonin on cardiovascular system. Now as serotonin exerts direct as well as indirect effect on the blood vessels, it produces vasoconstriction as well as vasodilation. So the net effect of 5-HT on the blood vessels is highly complex. So by the virtue of its direct action, serotonin causes constriction of the smooth muscle cells located on the walls of the blood vessels. So this causes constriction of the blood vessels. That means their diameter reduces, and this is termed as a vasoconstriction. So by virtue of its direct action on the blood vessel, 5-HT causes vasoconstriction. Indirect action of serotonin on the blood vessels produces vasodilation. Now, this vasodilation is mediated by the release of endothelium-derived relaxing factor, that is nitric oxide, from the endothelium. So, serotonin, by virtue of its indirect action, produces vasodilation. In addition to this, 5-HT also causes release of adrenaline from the adrenal medulla. Now, adrenaline we know is a sympathomimetic. Now, as 5-HT produces vasoconstriction as well as vasodilation, larger arteries like coronary arteries and veins are constricted due to direct action of serotonin, and also due to serotonin mediated release of adrenaline from adrenal medulla. So, this causes excessive vasoconstriction and increase in the blood pressure. Now, the body does not want excessive vasoconstriction and excessive rise in the blood pressure, so body activates coronary chemoreflex. Coronary chemoreflex causes stimulation of vagus nerve, release of acetylcholine, and acetylcholine produces bradycardia, that is fall in heart rate. It also causes hypotension, that is fall in the blood pressure. So, this is the effect of serotonin or 5-HT on larger arteries and the veins. Now, in microcirculation, that is arterioles, capillaries, smaller blood vessels, arterioles dilate. Now, due to arteriolar dilation, spaces between the endothelial cells increases, and this further causes increase in the vascular permeability. That is, fluid from the arterioles pass into the tissues. That is termed as the increase in the vascular permeability. So, this fluid, it passes from the blood vessels into the tissues, and this fluid, it accumulates in the tissues. Now, intravenous injection of 5-hydroxytryptamine in animals produces triphasic response characterized by early sharp fall in the blood pressure. This is due to coronary chemoreflex. Coronary chemoreflex, as we have already discussed, causes stimulation of vagus nerve, release of acetylcholine, and acetylcholine reduces blood pressure. Now, this early sharp fall in the blood pressure is followed by brief rise in the blood pressure. Now, blood pressure rises due to vasoconstriction, that is the direct effect of serotonin on the blood vessels, and apart from this, there is increase in the cardiac output due to increase in the heart rate mediated by the release of adrenaline from the adrenal medulla by the serotonin. So, there is brief rise in the blood pressure. Now, this phase of rise in the blood pressure is followed by prolonged fall in the blood pressure. Now, prolonged fall in the blood pressure is because of arteriolar vasodilation and increase in the vascular permeability. This all we have already discussed. Now, thus effect of 5-HT on the cardiovascular system and on the blood pressure is highly complex. However, very important to note that 5-HT is not involved in the physiological regulation of blood pressure in the body. Now, second is the effect of 5-HT on the visceral smooth muscles. Most important is the effect of 5-HT on the smooth muscles of gastrointestinal tract. As we have already discussed, 90% of the serotonin is produced in the gut, and this serotonin is stored in the anterior chromaffin-like cells in the gastrointestinal mucosa. Now, direct action of 5-HT causes contraction of the smooth muscles of GIT, while indirect action of 5-HT is through the stimulation of enteric nervous system. Now, enteric nervous system consists of network of neurons found in the wall of GIT. Now, 5-HT4 receptors are located on the enteric nervous system. Now, these 5-HT4 receptors of enteric nervous system are activated by serotonin. This causes release of acetylcholine. Now, acetylcholine is released from the myenteric motor neurons. Now, this released acetylcholine, it causes enhanced peristalsis, and increase in the intestinal secretions. Now, enhanced peristalsis causes increased movement of food in the forward direction in the gastrointestinal tract. Now, in addition to this, emesis or vomiting is induced by the stimulation of 5-HT3 receptors, 5-HT3 serotonin receptors. Thus, 5-HT4 agonist like metoclopramide increases peristalsis, thereby they increase the gastric emptying and are used as prokinetic agents, while 5-HT3 antagonists like ondansetron are antiemetics. Next is the effect of serotonin on the glands. Now, 5-HT inhibits gastric secretion. It inhibits secretion of acid as well as pepsin. Now, in addition to this, 5-HT increases the production of mucus, and thus 5-HT exhibits ulcer protective effect. However, effect of 5-HT on other glandular secretions is not significant. Next is the effect of 5-HT on the nerve endings. Now, afferent or the sensory nerve endings, they are activated by 5-HT, and this causes tingling, that is numbness due to the irritation of nerves, then pricking sensation as well as the sensation of pain. Then effect of 5-HT on the platelets. Stimulation of 5-HT two-way receptors shows weak platelet aggregating effect. Now, next is the effect of 5-HT on the central nervous system. Now, injected IV, 5-HT does not cross the blood-brain barrier and thus it does not produces central effects. However, as discussed, 5-HT1 receptors are located in the brain. 5-HT1 receptors are autoreceptors. Now, 5-HT1A receptor is the most widely expressed receptor in the central nervous system, and 5-HT1A receptors are located on the raphe nuclei of the brain stem. Now, these receptors are autoreceptors. So, activation of 5-HT1 autoreceptors, which are located centrally, inhibits firing of serotonergic neurons, and serotonergic neurons are prevented from releasing too much of 5-HT at the synapse. So, activation of 5-HT1 autoreceptors reduce release of 5-hydroxytryptamine. Now, in addition to this, activation of 5-HT1D and 1B receptors located centrally causes constriction of cranial blood vessels, and this is very useful in giving symptomatic relief in the migraine. And therefore, triptans like for example sumatriptan, it is a 5-HT1D 1B agonist, and sumatriptan constrict cranial blood vessels and it exhibits anti-migraine effect. So, this is in brief on pharmacology of serotonin. Please note that the information provided in this video is meant exclusively for students. Do not use this information for the clinical purpose. And if you find the video useful, kindly like, subscribe and share this video. Thanks for watching this video.